Okay, well, we want to welcome everyone this morning for our press conference. We want to give the community an update on the planning and decisions that have been made as we deal with the coronavirus outbreak. We had a preliminary planning meeting earlier that all the local agencies could update each other as to what plans they have been putting together. This actually started about 9 or 10 days ago, but my goodness, how much has changed over that 9 or 10 days, and particularly these last probably 3 days. So we felt it was important to bring the media here to hear from these different agencies and our government officials and then get this message out to the public because this is a very fluid situation. So I'm calling on Sarah Jo Best from the Lincoln Trail Health Department first. It's wonderful she's taken time to come over here. She represents 6 counties. So she's got a lot on her plate, so we're going to let Sarah Jo go first, and then I'll be calling on the rest of the agencies to speak. Sarah Jo?
Okay. Currently, there are 10 cases of COVID-19 in the Commonwealth of Kentucky. Harrison County has 5 of those cases, Fayette has 3, and Jefferson County has 2. To date, no individuals that reside in the Lincoln Trail District, which is Hardin, LaRue, Marion, Meade, Nelson, and Washington counties, has tested positive for COVID-19. However, we are preparing for a positive case. The new guidance from Governor Beshear includes all public and private schools utilizing non-traditional learning starting on Monday, March 16th. You'll hear from your school representatives that all Kentuckians should avoid large crowds. The recommendation for our faith-based services to be canceled this weekend. All state prisons and local jailers to restrict visitors, and our long-term care facilities restricting visitors to only those that are receiving end-of-life care, and that's after a screening process. We are really encouraging the public to go to reliable sources of information. We are trying to ensure that you have the most up-to-date information, and that is because it's an ever-evolving situation that's difficult to do. We encourage you to visit COVID 19.ky.gov, which is the state's website. We also encourage you to get local updates from the Lincoln Trail District Health Department website, which is ltdhd.org. It's under our Health Alerts tab. And use the state public health hotline, which is staffed 24/7 at 1-800-722-5725. It is very important that the public participate in the recommendations that are being made. It is not just a public health response or an emergency responder or a hospital response. Our public plays a huge role in how well the Commonwealth of Kentucky fares through this. So we encourage you to adhere to the guidelines that are there, again, at those reliable sources of care. We also want to encourage proper use of our healthcare system. If you are well and only worried, please stay at home so that our healthcare providers can take care of the most vulnerable and those that truly need the service. If you are ill, but you would not have sought care if it weren't for COVID-19, please do not go to the ER or the doctor's office. If you want advice, again, call that state hotline or your local healthcare provider. If you feel sick and you feel like you have an emergency, hospitals and medical staff across Kentucky stand ready to serve you.
Thanks, Sarah Jo. I guess the biggest change that we heard here recently is yesterday's announcement on what the schools are going to do, so I'll let the different representatives from our school districts speak on that item right now. First, we'll have Wes Bradley for the Nelson County School System.
So Nelson County Schools will be closed beginning Tuesday. We didn't have school today. We have teachers coming together to collaborate, to plan for what will be an extended NTI event. Our NTI event at this point in time is a 2-week event. We're really looking at this in terms of a 2-week planning process, knowing that over the next 4 to 6 days, we'll be making decisions about potentially a long-term NTI event. So at this time, all activities, school trips, events, childcare will be closed and or canceled over the coming 2 weeks. Again, we're only speaking right now to the next 2 weeks. We expect to update our families over the next 24 hours about additional steps that they can take to continue to engage with our schools. And our schools, again, are planning today for that work. We already had a planned day for teacher collaboration. So.
We are Ryan Clark from Bardstown City Schools. We are in session today on Friday, but we'll also be closed on Monday, March 16th. We will observe the 2-week closure, and we will be utilizing non-traditional instruction during that time, and we're informing our families of that. We actually are scheduled to be on a 2-week spring break following the 27th, I think. So starting on approximately March the 30th, I think our spring break is supposed to start, and we will observe that 2-week spring break. So we're scheduled not to return to classes until April the 13th. A couple of other items that, and Mr. Bradley mentioned this earlier in our meeting today, so he was sharing this. We are providing school lunch services that will start, for us, that'll start on Tuesday next week. We will post locations where we're actually going to bring lunches to the community for students that need that. There are 4 locations for us within the city limits that will be delivering or make lunches available to folks to come and get, and we'll bring those to different locations in the community. And that is posted on our website and also social media for us.
Thank you, Ryan. Tom?
I'm from Tom Hamilton from Bethlehem High School. I think I'm speaking for the Catholic schools in the county, but I'll reiterate where we are. We're going to follow the same recommendations. We too have a 2-week spring break scheduled beginning on the 28th of March, and we will observe those 2 weeks, so we'll get an additional 4 weeks out. I think it's important that as we're doing this as schools to reduce the social interaction. We're certainly going to stop all activities, after school kinds of things. It's important that parents cooperate with that and make sure that social interaction is held to a minimum. It's not something where we need your help with that, and to work with us on that as well.
Thank you, Tom. I would ask the representatives of the hospital if you all would come over here to address the media. Introduce yourself and what your positions are.
Sure. So I'm Netta Nuz. I'm the Director of Operations at Flagey.
I'm Cammie Poolwater. I'm the Chief Nursing Officer at Flagey. And so what we've done at the hospital within the last week, we do have a skilled nursing facility at Flagey, and we are following the Office of Inspector General guidelines and no visitation to that skilled nursing unit unless there's any emergency or end-of-life care, in which there's a strict screening process that will happen. We're also checking all the staff on that floor that comes into work, their temperatures. Then for all visitations into the hospital, we are reducing all entrances to access into the facility, screening all visitors and those seeking treatment to come in. Any visitors that show any respiratory symptoms, if they're not there to seek care, we're asking them not to come in. So we're restricting that. And then being able to, manage that process through. We're very lucky to be able to be part of a larger organization and have a lot of resources and access to things. We are also having several calls daily with our organization here within the market to be able to prepare, keep up with supplies, deal with staffing, those kind of things. And we do have, we go through many drills throughout the year, emergency preparedness. So we feel we are very prepared with what we may have facing us.
Thank you. Joe?
Joe Pruitt, Nelson County Emergency Services. We've seen a spike in EMS over the last week in general illness type calls, so it's forcing our hand to develop some protocol and screening mechanisms. I'll be working with our Director of Dispatch this afternoon to start asking some additional questions to callers for service for EMS. Low acuity calls will have to be handled differently. We'll probably ask the caller or the patient to check with their local physician or medical provider to see if they actually need to be transported to the emergency room. The emergency room is overwhelmed with patients. As a part of our service and partner with Flagey Hospital, we have set up a hazmat tent at Flagey that will be utilized by the folks at Flagey for screening purposes rather than going into the ER. Our personal protective equipment that we use with first responders as well as the folks at Flagey is in short supply. We're unable to get it. It's back ordered with every company you can imagine. So as we run out of those resources, it puts an extra burden on our staff and our responders to respond to those cases. So we just ask really that if it's a general illness type call, if you feel ill, do not utilize the emergency resources for those type of calls unless you really feel that you're in a life threat situation and need to be taken care of.
Thank you, Joe. Judge Watts?
Thank you, Mayor. Today, this afternoon, I plan to issue an executive order declaring an emergency in Nelson County, primarily for precautionary measures, where it allows the judge to waive a lot of laws and rules and regulations related to the needs of the community at the time. In particular, we will issue an order to all the sports leagues that's at Dean Watts Park, the soccer leagues and the baseball leagues. We'll cancel for a certain period of time, and Bryce is working on that right now as far as the time frame. It probably will mirror what the schools are doing and then evaluate once that is over with. First of all, I thank the Governor Beshear for his daily press conferences. It's been a big asset to me as a judge executive to listen to him and learn from him and listen to his experts at the higher level. And the resources that he's made available to our local health department has been a great asset. Sarah Jo, for her continuing, I mean, she is going one way to another. Last night I was talking to her kind of late, and her and her staff, Stephanie, are doing a great job. We appreciate them so much, and you don't think about those people until you really need them. The other thing is I want to tell the public this virus is real, and the potential widespread can be devastating, as you can look in other countries that are dealing with this. So we are going to take, I think whatever we do here will allow us to go through this potential crisis in a smooth way. I've heard a lot of people talking about the media overreacting and the press overreacting, but this is real, so take it serious. We're taking it serious. We spent a lot of time the last few weeks researching and understanding the coronavirus itself and trying to understand what makes it different from any other virus, flu or whatever it may be. And most certainly the critical thing is that there's really no vaccine for it yet. And reading this morning, what I found, it's even further out than they initially anticipated. So keeping those that are vulnerable away from this is important. And we do not want to overburden the hospitals. I can tell you there's only so much equipment there, so many ventilators there, and it's usually taxed anyway during the flu season, much less you throw the flu and other viruses on top of that. So we need the cooperation from the public, and I think the public will respond. They see us responding in a professional way. The governor's responded in a super great way for us, and just do your part, please.
Thank you, Judge. As you can see, I think there's two things we really got to take away from this is that, definitely we're still in what we consider a prevention and containment mode, trying to control the curve and not overtax our health providers. It's kind of a twofold thing. So the city recreation will follow the county. I think we'll at least be closing all our leagues, and also our open gym will have to close until at least the first of the month. That's where we're going to be from there. But as you can see, a lot's changed since last week. One of the best ways we can hopefully contain this and prevent it is by reducing social interaction, and you see all the decisions that we've been making here. It's a major sacrifice, and a hardship for a lot of people, but the word I heard yesterday a lot was unprecedented. And I think this is an unprecedented health issue in our whole country and, of course, around the world and here locally. We're in some uncharted territories. I don't think I can recall that we've had something this significant that is affecting so many agencies and so forth. Because, you know, we are dealing with a pandemic, and this is something larger than we've ever had to deal with in the past. But the good news is people like Sarah Jo Best and her people at Lincoln Trail, they are trained to deal with these sort of things. This is not the first time we've had something like this. We've had Ebola and hepatitis C breakouts and so forth. So the good news is we can depend on people like that to give us great advice and direction as we go forward. You know, we aren't asking all our first responders to speak, but they all have their emergency plans in place. They're going to be following it. And all of these people in this room and some that aren't here that were here earlier, they have been working diligently for the last 9 or 10 days to get these plans in place. But as the judge said and others have said, at the end of the day, this is going to be up to the public to really do their part. It can't just all fall on the agencies that are providing these services to the public. You know, our attitude should be, this is about us, all of us, and not me. That's what everybody, every citizen, even including our children, have to have that attitude. And with everybody's help, we're going to get through this. You know, speaking on behalf of the city, most of our city services are going to continue uninterrupted as usual. You know, all our utilities will continue. You know, garbage and public works will continue. We don't anticipate any interruption with that, but we are trying to take some measures here at City Hall, just like other places are doing, to try to slow the amount of traffic that we have here. So we, like a lot of the financial institutions, since we deal with so many utilities and bill payments, are going to encourage people to use our drive-through window, pay online, and we have drop boxes. Obviously, there'll still be some cases that'll have to come into City Hall, but we are trying to sanitize the area as much as possible and reduce that traffic, because the other most significant threat to this whole effort is if, you know, our employees get contaminated and we lose fire protection, police protection, EMS, hospital people, doctors. You know, that is why it's so dependent upon the public to follow the hygiene recommendations that everybody have heard by now and avoid large gatherings. With that being said, we are just encouraging all large gatherings that are planned for this next 2-week period to be canceled. However, I think City Council, we will have our next meeting. I think Fiscal Court's planning to have their next meeting. Right now, you know, Chamber of Commerce and other agencies are already canceling their public meetings. I think we will still have, at this point, planning and zoning will still have their meeting. We are just, and also Historic Review Board will probably have their meeting this month, but they're going to take precautions to kind of make sure that the public and the members of those boards are have enough distance between them to you know, eliminate any interaction as best they can. I guess now I would open up for any questions the media might have of any of us who are here.
Okay, I'll go ahead and ask a question. So I've seen this a lot, but I don't know if I've found a concrete number. What is a large gathering? Is it 20 people? Is it 100 people? Is it 1,000 people? Do we have guidelines on that?
There's not. I think if you notice, I think like Louisville is talking like 200. I saw last night New York City is 500. My thinking here locally, it should probably, and I'm not a health expert, so I'm just going off of what I've heard here over today's meeting. I think, you know, 50 or above would be considered a large gathering, unless anybody else has
I would agree with that number, yes.
You know, I think it's all relative to your population base. You know, you take a city like New York, 500 is a big gathering. Here, it would be
50 in this room would be pretty tight. But yeah, I agree with the mayor on that. You know, 200, I heard 200 or 250 last night from some, I think it was somebody in Louisville on a meeting, and it's really up to, I think it's just the population, the size room you're going to be in, and are you going to be in open air versus an enclosed air? All that would probably play into consideration.
Any other questions right now?
For the schools, will staff be on campus as well? I mean, or will they also be off?
So we've been talking, and right now, we're just speaking with the health department, we feel like we're going to use some social distancing practices and some common sense approach to sanitizing our buildings and using hand sanitizer, but that our staff would be reporting at least for the foreseeable future. That could shift over the course of the next 5 to 7 days based on health department recommendations. In fact, it could shift at any point in time when that recommendation changes. So at this point in time, we are working from the assumption that staff members will report to work with social distancing practices in place.
The only thing I'll add to that is that, we'll certainly have staff members with different needs, either health needs or with child care needs. So we're working with those staffs in unique situations too.
That's basically what we'll be following as well.
I think you're going to hear, later today, the health department, and I won't preempt their report, but I think you're going to see a lot more news be released from Lincoln Trail and other statewide health departments on recommendations for closures of other operating type agencies and businesses. She just wasn't, at this point, she couldn't release that to us this morning, so she did tell us, though, to stay tuned, that there probably will be some other major recommendations to keep the social interaction to a minimum during this time. Anything else?
I got more, but I don't want to let people ask. This would be a question more for Joe or for Flagey. What is the capacity locally to deal with infections? If we were to start to see infections, do we have an inventory on, let's say, respirators, or on how many people you could treat?
We do keep up with that, and we have daily checks looking at resources available if we need, in addition to what we have. We've done taken steps to be able to add beds to make more of a quarantine area, should we have that need. So we are definitely working with Joe and his team with the tent to be able to help triage more effectively patients coming in that may not need, hospital level of care, but they've come in with other concerns that we do need to see and treat. That way we can keep them out of the hospital and not, cross-contaminate or any of those kind of situations, to be able to keep things separate to triage better.
But do we have a number kind of on how many people, can we deal with 100 infections? Can we deal with 200 infections? And do we have that sort of ballpark number?
Currently, we would have to deal with each situation dependingly, because a lot of that's going to depend on, do we have resources to be able to transfer certain types of patients out? So the amount of what we can keep in our building and what we can provide negative pressure for, which is the recommendation at this time. We've brought engineers to kind of to look at those things, to give us some ways to provide more rooms. But currently, to give you a number, we're going to have to deal with everyday basis, because we're going to have to make some stipulations and concerns based on the amount of influx of patients we get.
Correct. And our partners in Louisville or Lexington too, if they're maxed out with their capacity, it may cause a different scenario that we may have to adjust to, depending on what they're able to take as well.
And keep in mind, the CDC regulations and guidelines for us are changing almost daily.
Yes.
So things that we may not can keep or need for today, we may be able to do this afternoon. So we're constantly looking at those things too as they progress.
For me, we have 4 staffed, equipped ambulances on duty a day, 24-hour period. Now, having said that, if Flagey needs to send a patient to Louisville on a ventilator, we have 1 ventilator. So that squad or that ambulance is out of county with the one ventilator, and we share equipment. Flagey and EMS work back and forth on sharing equipment when need be. But if we're dealing with general illness calls and Flagey has emergency transfers of these type of patients to other facilities, then our 4 trucks may be tied up. So that's why we are really insisting that people do not overutilize our services. Keep the services available for the sick that really need the services.
And can people, like, there's been questions I've heard about whether, whether testing is available. Is testing available for people? Like, do you have to go to your doctor for it? If someone says, hey, I feel like I need to be tested, what should they do?
We do recommend, if you are well and are not in emergent type need to come into the emergency room, to please call your PCP, have conversations prior to going to see him, or either him or her, or going into the office. If it's questions related to such, there's also lines set up with Public Health and with Kentucky Department of Public Health as well that they can call. But to answer your question, we do have protocols that we have to go through, which is recommended by the CDC. So we do follow those protocols. For those, there are certain questions. If a patient that's seeking treatment answers positively, then we do take those measures, and then we'll have to contact the state to go through their recommendations for testing. And then beyond that, it's up to the clinician, and we do have protocols in place for any kind of private testing that should necessitate at that time.
Another good avenue for a lot of folks that they may not realize is if they have private insurance companies, a lot of those private insurance companies offer a hotline to a medical professional to intervene, so to speak, in answering questions about their illness or symptoms.
Yeah, of course, the tests are not available on demand, obviously, but of course, Sarah Jo's gone, but the health department, would be I can tell you my first call after I've gone talked to the doctor. If they haven't gone through it, but just contact the health department. They'll guide you through the screening process, and they get down to the screening process. If they think you need to be tested, they're going to get you in the door a whole lot better. It'd be like a hospital. That would be
Correct.
You go to don't go there, but get somebody to go through the protocol with you, and then they'll tell you whether you need to be tested or not, or if you qualify to be tested or not. Because those tests are limited. I understand the state down doing theirs the last few days, maybe a week. Used to have to, first few days you had to send them to Atlanta.
The state tests do go to Frankfurt to be tested.
Yes.
And then there are private companies out there.
But they're about a 4-day
yes.
turnaround, 3 or 4 day turnaround.
They're a little bit longer, yes, sir.
Yeah, the states said that they can get theirs turnaround usually in 24 hours.
A good headline for you guys is, calling an ambulance will not get you in the ER.
That's a good advertisement there, Joe.
Well, Joe, you said that you guys had increased calls. Has it been related to COVID-19 concerns?
Well, the increased calls that we're having over our emergency calls is a general illness calls coming into dispatch. I've had nausea and vomiting, I'm running a fever, and they want an ambulance to come and treat and transport them to the emergency room, and that really is taxing the service that is not ambulance type patients. Those folks can get a hold of their physicians, other avenues to have those symptoms evaluated, and then get pointed to the appropriate facility for treatment.
Jim, you have anything? No?
Yeah, I got one more. So with Flagey, so let's say that I need to be treated for COVID-19. Can I expect to be treated at Flagey, or should I expect to be transferred to another facility?
We are prepared to take care of patients. Yes, sir.
Yeah.
Going
I
back,
hope that, go ahead.
sorry, going back really quick to the food service, I know Ryan talked a little bit about it. Will the county system also have anything in place to?
Yeah, we'll have a similar program. We're starting out with a drive-through option at every school. So students and families could go to the school closest to them. We see over the course of the next few days, starting on Tuesday, that may be condensed into certain areas. We're really trying to evaluate what the data needs are, and we can't predict it until early next week in terms of families and students.
Will those locations and times be posted on
Yep,
Facebook? or
those were
anything?
shared with families yesterday in a letter, and will be shared again today.
Anything else? You know, again, I just want to close by just saying we cannot overemphasize the cooperation that's going to be needed from the public in general to help us get through this. You know, containment and prevention, and the worst thing we could do is end up overtaxing our assets and our health providers. That will be a crisis in its own self. So people, I hope you all can get that message out that they need to utilize these websites for direction on what to do if they've got issues going on. There's all kinds of information available, but we just need everybody to cooperate and take the attitude that by them sacrificing some of their own, they're helping other people. They're helping their family members, their co-workers, friends, and so forth. It's going to be a sacrifice on the parts of all of us. It's going to be a hardship, but this is the only way we're going to get through this. And we certainly appreciate all the hard work that's gone into place. We will try to keep you all updated on a timely basis as some of this stuff changes. Obviously, we've all seen what's happened in the last 3 or 4 days. We hope maybe it'll settle down to some degree, but we certainly will do our best to keep the media informed, and then you all do your best in the job that you all do in informing the public. We need your help badly in this effort. So thank you all.
Thank you all.
Mayor, can I ask just a real quick question?
Yeah.
According to how would you advise your constituents as far as you can kind of see from above of what you guys are trying to do, and I could be wrong about it, but it sounds like if you isolate the illness for 15 days or 14 days, and hopefully a lot of that virus will die off. But as far as day-to-day activities, what should the normal person be doing as far as should you restrict your activities? Should you not go to, not just events, maybe to your barber, or at what point should you isolate yourself? Should you be concerned if you got symptoms of a flu or cold or sniffles? It seems a bit gray on how to.
Well, actually, excuse me, I know it's directed at the mayor, but the health department has those guidelines. And it's in fact, I sent you guys an email yesterday or the day before on that. And that's a big asset. If you do get the fever, like the flu and so forth, you should stay at home anyway. We have a tendency to go out sometimes. We've probably all been a little bit guilty of that and been a little feverish. But I guess I open my big mouth. It was your question. But I'm into this. So.
Yeah, it's because you're kind of getting mixed messages from social media and the federal government, and then you're hearing the governor come in and say, look, we're closing down schools, and we don't really know how many people may be infected with this virus and how serious it may be. So I think people, the general population, they don't know really how to approach it. They're kind of confused about, what should I do?
I think that healthy people, those of us who are not experiencing health issues, I think we're supposed to continue on our day-to-day thing. I don't think anything's changed since early on in this, is that if you've got some illness, if you're dealing with a cold or allergies and all that, you need to stay at home. Last week we were telling you to keep your children at home if that happened. That's been taken care of now, but I think if you got an illness, you need to stay home until you get better and not get out. Don't go to the barber shop. Don't go to the dentist. These non-emergency things. Don't don't go buy any more toilet paper, you know.
You're not gonna get it, you're not gonna get it.
Well, I'm glad to see the leadership up here, I'm just gonna say that. It's, I mean, I know we've been through the, what was the last one, 09? That was no, it was H1N1, and that killed a bunch of folks. But this seems like it's a whole lot different than that virus.
There's no vaccine for it.
Is it?
I think that's a big difference. And you can have it for 3 days and not know you have it and transmit it. So I see a big difference in what we're dealing with today than what we were, right, you all are professionals. But I see the big difference, no vaccine and the transmission, you can feel fine and give it to him and he gives it to him without knowing it for 3 days. Just think how many people you talk to and touch in 3 days.
We're asking our parents to reduce, you know, access to social gatherings, large groups, all that kind of stuff. So even if you're healthy, just don't get into a crowded area. And I think that's.
I'm like the mayor, I think this is only too many people. Y'all stop breathing for a minute.
Are you guys thinking about closing your meetings to the public as far as fiscal court?
No, I'm actually going to make some changes on how we set up the court meeting.
Gotcha. Good deal. Thank you.
Anything else?
Good questions.
Well, once again, I want to thank all the people who have participated today and all the cooperation we're getting with all the different interrelated agencies here to combat this situation. We're fortunate that we have a large, dedicated group of professionals that are taking proactive measures to keep this under control as best we can and moving forward. So, thank you all.
Thank you, media.